We've reviewed the definition and pathophysiology of pulmonary emboli, including the substances that can cause pulmonary emboli, including air, amniotic fluid, fat, and most commonly, clot or thrombosis. Other substances can be inadvertently injected through intravenous lines and also result in embolus. Now let's move on to the presentation of pulmonary emboli. This is how we describe PEs. When we talk about PEs, we talk about the timing, the anatomy, the hemodynamics, and the signs and symptoms. In regards to timing of pulmonary emboli or PE, we can have acute pulmonary emboli, we can have subacute pulmonary emboli, and we can even have chronic pulmonary emboli. When we talk about acute PEs, we're talking about immediate pulmonary emboli resulting in signs and symptoms immediately. Subacute pulmonary emboli have signs and symptoms that develop over days to weeks, whereas chronic PEs develop over years. When we talk about the anatomy of pulmonary emboli, we're talking about where the clot lodges. When the pulmonary embolus enters the pulmonary circulation, it can lodge at the main takeoff of the right and left pulmonary arteries. This is called a saddle embolus. If the blood clot moves more distal, you can actually have segmental and sub-segmental pulmonary emboli. The more proximal the lodging of pulmonary emboli, the greater the burden of pulmonary emboli, and the larger the size of pulmonary emboli will determine the clinical consequence and degree of hypoxemia. Saddle emboli occur in up to 3 to 6% of pulmonary emboli, and 22% of saddle emboli are hemodynamically unstable. This carries a 5% mortality. You can also describe pulmonary emboli by their hemodynamics, either stable or unstable. Unstable pulmonary emboli are defined by a systolic blood pressure less than 90, or a drop greater than 40 millimeters of mercury over 15 minutes, or requiring inotropes and vasopressors to maintain blood pressure. Unstable pulmonary emboli are also called massive or high-risk pulmonary emboli. You can have stable pulmonary emboli that have normal blood pressures. If it's submassive or intermediate risk, the blood pressure is fluid responsive and or has right heart strain. If you have completely normal blood pressure with no or mild symptoms, it's considered a low-risk pulmonary embolus. It's the unstable pulmonary emboli that have the highest consequence for patients, that are the most dangerous for patients, and require rapid treatment and support. We'll talk more about the support and treatment of pulmonary emboli in another lecture. We can also describe emboli as either symptomatic or asymptomatic. If your patient has a PE and they're symptomatic, it can occur as dyspnea, hemoptysis, wheezing, calf pain, orthopnea, cough, and commonly in sudden onset of pleuritic.
Guys, thank you very much for watching. Make sure that you like this video if you like it. If you don't like it, then do unlike. Like this video, subscribe to the channel, and please share this channel with others as well.